Turning out to Los Angeles County, where the number of COVID-19 cases continue to overwhelm area hospitals, especially those in communities of color that have been disproportionately affected by this pandemic.
All right, joining us now, CEO of the Martin Luther King Jr. Community Hospital in South Los Angeles, Dr. Elaine Batchlor. Dr. Batchlor, thank you so much for spending some time with us today. Where are you out there? How are you doing?
Good morning. So we are the epicenter of COVID. Los Angeles is growing the number of COVID cases every day. And the community of South Los Angeles that my hospital serves is a very vulnerable community, predominantly low income, people of color. This is where the essential workers live. These are the people that are stocking the grocery stores, driving the buses, cleaning up after the rest of us. They continue to go to work, they continue to be exposed, and they're being admitted to the hospital.
Dr. Batchlor, how are we doing on the vaccine rollout out there as far as you see it? Our Dr. Ashton just offered some ideas for speeding this up, but is it going at a pace that you are comfortable with?
I heard some of her ideas, which I think are good ideas. We are still in phase 1A, which means that we are distributing vaccine to healthcare workers. We've given over 1,000 vaccines to staff in my hospital, and we agree that we're looking forward to moving on to phase 1B, which will allow us to start vaccinating actual members of the public.
Dr. Batchlor, in the meantime, though, just to make it clear to everyone just how dire the situation, and I don't know what your answer is going to be, do you believe you could get to a point where you might have to turn people away from your hospital who need care?
Well, hospitals don't turn people away. So we take everyone that comes in the hospital and we attempt to provide care for them. If hospitals are overwhelmed with patients, that's when they move toward what we call crisis care.
But when you don't have beds, where do the patients go?
So what happens in hospitals is when the hospital fills up, then the patients are quote unquote boarded in the emergency department. That means they are staying in the emergency department. When the emergency department fills up, patients arriving by ambulance often are then stuck on an ambulance.
Wow.
Dr. Elaine Batchlor, we know it's a busy time there for you, and we're dealing with a crisis in D.C., but this is a crisis, this pandemic, and like you said, you're the epicenter of the epicenter of the epicenter, essentially, where you are. So thank you for taking some time out, and good luck to you all out there. We hope to talk to you again, all right?
Thank you.
Frontline heroes there, right there, each and every day.
The way she put it, epicenter of the epicenter of the epicenter.
Yep.
Oh, goodness gracious.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.